So now, why is management of cough important? If you see by year, the prevalence of chronic cough is very much. It is from 5% to more than 20%. If you look at the world data, the prevalence is very high. And if you look at in your countries, also in the Middle East, from 3% to almost 22% and 19% here in the UAE. So the prevalence of cough is very high. So it is a problem. Excuse me, even I have got a flu, recovering from, I actually off from work for flu. So cough, I've also got a cough, so excuse me. So chronic cough causes considerable morbidity. It can cause nighttime awakening because nighttime cough can be very irritating and disturb the sleep. It can cause exhaustion, particularly if you have got a lot of cough, haven't slept in the nighttime, and the daytime you've got continuous cough. It causes exhaustion. It can cause office absenteeism. I'm away from work today because of the cough associated with viral infections. You've got a spouse who's unable to tolerate the cough, so you cough, then the spouse can't get sleep. Urinary incontinence, stress urinary incontinence is very well known in women having cough, and you can't go to movies or places where you want to be. There has to be a silence, so coughing causes a disturbance. Sometimes too much of cough can cause cough syncope. A severe amount of cough can cause a transient reduction in the blood supply to the brain, and these individuals can get a cough syncope. Now, people can think about the social stigma. They feel that every cough is probably a viral infection, which can probably be spread. So it's a problem. The chronic cough is a problem, and if you look at it from the impact, there's a cross of chronic cough. There's a cross-sectional European survey which showed that in 96% of individuals who had chronic cough, it affected their quality of life. It affect the people could not do the things they wanted to do. 91% felt fed up and depressed because of their cough, and 94% of the cough patients, the cough disturbed or worried their family members and friends. The other interesting thing is that only 30% felt that the doctor had dealt with the cough in a thorough manner. And there's been a limited, there's a benefit or almost no benefit with the medications they have tried so far. So this is the whole spectrum of chronic cough. It affects the quality of life, and it also, there is a perception amongst patients that maybe often enough has not been done by the medical professionals in helping them with the cough. And of course, lastly, 69%, 70% of the OTC medications are not effective. So now, coughs can show varied reasons. It could be, and there may be some overlap in some of the aspects that we are going to discuss, and that just for the sake of repetition can help to drive down an important point in a much better way, and that actually is important. And if you see here, look, the varied reasons can be bronchitis, pharyngitis, asthma, rhinitis, pneumonia, gastroesophageal reflux, upper airway cough syndrome, sleep apnea, and so on and so forth. Okay, and we in the next half an hour we might I will be referring to this on a regular basis. So what happens in the cough phase? There's a throat irritation here, and you take a deep breath, you compress the chest, and you cough out. Okay. Now the expulsion is important. So if there is phlegm, if there is a productive cough, it's important that the cough, that the phlegm is coughed out. So a phlegm which is having a phlegm which is having a phlegm which is coming out should not be suppressed. So that's the important message I want to put across here. So some basics, now let's talk about the clinical definitions. There's acute cough, there's subacute cough, and there's chronic cough. And it's important to classify this in this manner because the guidelines will address the diagnosis of acute, the diagnosis and the treatment of cough based on this classification. What is a refractory chronic cough? A cough which persists despite optimal treatment for the presumed associated common and uncommon conditions, according to best published guidelines, is what is called as refractory chronic cough. An unexplained chronic cough is when no diagnosable cause for cough has been found, despite extensive assessment for the common and uncommon causes. So if there's cough less than 3 weeks, it's acute cough. Between 3 to 8 weeks is subacute cough, and more than 8 weeks is chronic cough. So when we talk about chronic cough, we're talking about cough for more than 8 weeks. Now, there is what the neurobiology of the cough is that suppose if there is an irritant, a physical or chemical stimuli affecting the airway sensory nerve fibers. Now, the airway sensory nerve fibers can be present at different levels. At the, within the lung, within the lung, you can have it within the airway, in the larynx. So at all these points, if the sensory nerve fibers are stimulating, they would convey information to the brain here, and then the cough is manifested. We can cough also voluntarily. So important, say somebody asks me to cough, I can cough now, but it also means that to a certain degree, we can also suppress the cough voluntarily. So now what are the causes of cough, and the pathways which lead to the cough? So as I mentioned earlier, URTIs, upper respiratory tract infections, COPD, rhinosinusitis, a very common cause of cough. Sometimes it can be a ACE inhibitor related cough. Somebody for hypertension has been started on an ACE inhibitor and develops a cough. So that can be an ACE inhibitor related cough. GERD, that's also very undiagnosed reason for cough, and really it can take some time for us to explain to patients that GERD, that the cause of the cough can actually be in the stomach, in the food pipe of the individual. So what happens is these all act as triggers. They affect the cough afferent pathways and cause an acute cough, which can be self-limiting. But if this continues, if further, it can lead to a chronic cough. A chronic cough can lead to airway inflammation, and that airway inflammation further affects the chronic airway afferent pathways, and then you're moving in a vicious circle. The triggers, as I said, can be a URTI, a deep breath, a mucus secretions, nose flowing forward, yes, but more often is important the postnasal drip or the upper airway cough syndrome. If the nose is flowing at the back of the throat, then that can trigger the cough. And pollutants, ask us about it. Pollutants are a very important cause.